So I would wash my hands. This is for female catheter. I would go to the chart. I'm going to open it up. I'm going to look in here. I'm going to find my order. Most of the time they'll specify what size they want, a 16 French, 20 French, and the size of the balloon. Sometimes they'll state the reason. Then I am going to go into the patient's room. Knock, knock, knock. Good afternoon. How are you?
Good. My name is Angela, and I'm one of the student nurses at Bainbridge College. And Dr. Smith has asked us to put a little tube into your bladder to help drain the urine out. Did he talk to you about that? He did? Okay. Well, it's going to be a little bit uncomfortable, but I don't think it'll be painful. The first thing I need to do before we get started is I need to get you to state your name for me and tell me your date of birth. Mary Sue Harris. August 12th, 1981, right? Exactly. That's exactly who I'm looking for. Well, let me gather up some supplies, and I'll be right back with you.
Okay. So then I go and I get me a Foley tray. Then I get me a pair of sterile gloves. I like to have an extra pair. I found the ones in the container don't always fit me right, and sometimes they're just stuck together, and I just can't seem to get them to work well. Can I have another pair of regular clean gloves, please? Okay. And it tells us our size here, and this is a 16 French 5cc, which is exactly what the doctor ordered. So I come in after I've provided for privacy, and then if there's anybody else in the room, I ask them to leave the room. So I am going to put on my gloves, and we are going to clean them with soap and water, or if it's a facility that has the disposable washcloths, you can utilize those also. And for purposes of the checkoff, I'm happy with you using those. So I let her know, ma'am, I'm going to pull the covers down a little bit, and I'm going to wash your perineal area for you. Will that be okay? Okay, great. And I'm going to drape this towel across it to make you feel a little more private. I go ahead and I bend her legs up. And I open them up as wide as I can because it's going to make the entire procedure easier. I often ask them, if they can, to just relax their bottom as much as possible and let their legs just fall out and open up. Sometimes the elderly males and females have a hard time doing that because their hips just don't work as well as they used to. So then I get my disposable cloth. I'm going to go here. I'm going to open her up. Ma'am, I'm going to be touching you. I go down the center and clean her. Then I dispose of that. I get another cloth. I go to my far side. Okay. Dispose of that. Then I'm going to go to the side closest to me. One swipe. Okay. All right, ma'am. Now, if you'll give me just a second, I'm going to open up my sterile field, okay? I take my gloves off. I go wash my hands. And now I'm going to set up my sterile field. Okay. The hands have been washed. Now, I'm going to open up my kit. I'm going to slide this out. And this here is going to be my trash bag. I fold it back, make a little cuff, and I put it somewhere down here on the bed so that it's not in my way. I can get rid of this little paper. Then I am going to take my tray. I can touch this. I take this tray over here to the bed because I want to work from right here in the center. Now, if your patient is fighting, this probably is not going to work. It's going to contaminate your sterile field, but if they can follow directions, you should be fine. Okay, I'm going to go underneath and untape. Thank you. Okay. I'm going to open that up. And remember, I have the 1 inch around that I can touch and use if I need to navigate my box. Now, what I'm going to do is I'm going to reach in here, ungloved. I am going to grab the top piece here where it is folded down. Grabbing just the corners. Okay. Shiny to the honey. Okay. I put it down, I just drop it. If it's not positioned perfect, leave it. We'll fix it in a bit. Okay. Now, I'm going to open my sterile gloves. I am not turning my back to my sterile field. Okay, now, coming back to my area. I'm not using these sterile gloves, so I'm just going to get rid of them. And then this little drape here, I'm not going to use either, so I get rid of it. Now, the next thing I'm going to do is reposition my box so that it works for me. So I usually turn it. Again, making sure the components that I set down are inside and not touching that 1 inch margin. That is sterile. I am now going to touch it just to get it down out of my way. I am going to open up my KY jelly. I will squirt it here into my container. Discard. I will take my iodine swabs. I will open them up. I just opened up the package and then I set it back down right here. There are 3 swabs in those. This is a good time to ask your patient, are you allergic to iodine? No, I'm not. Okay. Then this is my fluid that I'm going to fill the balloon with. You test your balloon before. So I grab it. I come down here. I'm going to find the end of my balloon. I blow it up. I put all of the fluid in. I see that it is working appropriately. Now I can just let go. It will come back automatically. Okay. At this point, I want to take this blue wrapping off of here. You have to be very careful when you do this because this catheter tip will just flop out and go right into your unsterile field. So I come down here. So I start pulling it as I take it out. Then I just get rid of that. I'm going to take my tip, rub it in my lubricant. Then I take it and I set this back inside my box. I leave that syringe attached to my catheter area where I'm going to inflate it because it's going to be very difficult because I'm only going to have one sterile hand in just a minute to take that and attach it to that catheter. Now, I'm ready to touch the patient. I let her know, ma'am, I'm fixing to touch you, okay? Yes, honey. Okay, now, when I go here and I open up, you get a 1 chance deal. Once you open it, that's where you are. So try to open as wide as possible. The wider, the better, so you can see where you're going. Okay? Now, I'm going to take my swabs, and I tell her, ma'am, this is going to be a little cool, okay? I take my first swab. I go straight down the center to clean. I bring the swab around, drop it in. I do not take it and go straight over like this because now I have taken dirty, went over my sterile field, so that's why I come around here. Okay. Next, I will take my second one, go to the far side, then last to the inside. Now I'm done with that component. Now I'm going to take my catheter. Okay. I'm going to hold it fairly close to the edge so that it's close enough that I have control over this. Okay, see my hole. We're going to start inserting. We're going to go 2 to 3 inches till we see urine on the female, and then you go a little bit further. Once I see the urine, I'm going to take the other 2 fingers and I'm going to hold the catheter right there. If I don't hold it on a real person, it is going to slide right back out, and now we have to start all over. So I'm going to hold this. Then I'm going to go to the syringe right here. This is the reason you wanted to leave it attached. I am going to inflate it. I would put in all of the fluid. Once I have all of the fluid in, which it will not go for the mannequin, then I take these 2 fingers up here and I just let it come back gently until I feel that balloon inside there catch. So in other words, I know it's holding in place. At that point, I can let go. Okay? Then I come over here and I'm going to disconnect this. If at any time while this was connected I let go of that plunger, the fluid is going to come back and the catheter is going to come out. That's why I do that. Now I get rid of that. Okay, at this point, my sterile component is over. I set that down. I am going to go and change gloves into just regular clean gloves, and my reason is A, I have been touching her, and I have iodine all over these, so everything I touch is going to get iodine all over me. So I change these gloves. I wash my hands. I'll put on another pair of gloves. You doing okay? Good. And I see that I've got urine flowing. Alright, so at this point I would put a leg strap on the patient. So I come around here, and these are really fancy compared to back in the day when we started. You just got a piece of tape. But you Velcro it and find the right tightness. You don't want it tight, but we don't want it where it's snug and not sliding down the leg. Then I'm going to come over here. We want to have this where it's a little loose so it's not pulling on her bladder. I attach it. At this point, I'm going to take my Foley bag. I'm going to come down here and I am going to put it on the bed frame, not the railing of the bed, because we don't want it moving up and down. Okay? I'm going to clean this up. I will usually get a washcloth. I will clean the patient up because there is iodine on her, and she might like to put her panties back on, and it could stain them. So I put her legs back down. Cover her back up. I look great. We've gotten about 200 cc's of urine. It's clear. There's no odor, no sediment with that. And I go and I document everything that I just did, making sure I document all of those things I just told you about the urine and the size of the Foley I put in and the amount that I put in. I put up my side rail, put the bed in lowest position, whoosh, 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 go on my way. Any questions?